Afternoon, and we'll get going in just about another minute. A lot of people are still joining the Zoom, and so please do that. We've got our whole speaker panel assembled, and we'll be getting going in about 1 or 2 minutes after the half hour.
Thank you, Craig, for joining. And Craig and Angie, thank you. And Piyush, very, it's an honor to have you with us and to have your speaking to the expertise and your experiences that have been happening in the past few months.
Well, very happy to be here. Thank you for convening this panel, and we look forward to the discussion today. We had a nice dry run yesterday, and should be an exciting conversation.
I do.
Yeah, likewise, great to be here, and thank you.
Good.
Great. So we'll get started. I just wanted to say welcome to everyone for joining us this afternoon. This is FX Campion from MITRE, helping host our 17th Healthcare Coalition webinar. We are now on Wednesday afternoons for the course of the summer, 2:30 to 3:30 each Wednesday. And today we have a really fascinating panel put together to help talk about back to workplace coping with change for COVID-19. It's become apparent over the last several weeks as we're discussing various aspects of the pandemic that behavior change is paramount. Behavior change infuses everything from where we go to work to how we behave at home to what projects anyone might be working on through their employer and through their volunteer efforts. So life is continuing to evolve, and the good thing is there is a scientific base for understanding behavior and for understanding organizational development. Before we get to the panel, I'm going to ask John Halamka, who is the president of Mayo Platform and one of our sponsors, to give us an update on his perspective. He just mentioned he was on about 16 Zoom meetings today and has a lot of new information every day. John.
Well, thanks very much. And so let me start with just a couple of themes for this week. So coping with workplace change is actually a magnificent panel for today. I started my day with a Zoom to all the department chairs of Mayo Clinic. And one of the things we discussed was it isn't so much the volume of work that we're doing. It is the nature of how we're doing it. And that is, today, of course, we're meeting virtually by Zoom. And that's fine, but what it means is that if you have back-to-back Zoom meetings from 7 in the morning to 7 in the evening, that time to go to the water cooler, have the casual conversation, or just get a little bit of exercise is diminished. And so what happens, of course, there's Zoom fatigue and emotional exhaustion. And so as we start thinking about how this new normal, which for the next 18 months or so may very well be virtual in many respects, should include exercise breaks and mental health breaks and water cooler exercises and all the rest. So we had that interesting discussion. We think of our personal lives and how things have changed, where you may very well have whole families together and an inability to have quiet time. So you end up with mental and physical exhaustion, and it's not sustainable. So really look forward to the panel. Other things going on, we're getting near the data collections, and FX, of course, is very familiar with this, that we've been trying to do in a federated fashion from our EHRs. So very shortly, we will have analyses from registries, from federated queries, and I'm hearing from many sources that all of them are converging on what will hopefully be enough evidence to suggest efficacious steps forward as we wait for a vaccine. So I think we're making substantial progress there. And then, of course, there is Operation Warp Speed, work that's happening at HHS, DOD, FDA, CDC, and every day is now filled with discussions with these stakeholders, really all joining forces, recognizing that there must, in a time where Florida and Texas and Arizona and others are seeing such outbreaks and peaks and resource and personnel shortages that we need to take concerted action. So I would say, there you go, FX. People are fatiguing, but there's action ahead, and people are coming together as we get the data that will inform our next steps. Turn it back to you.
Thank you, John. That's a great intro. I had the pleasure of meeting Piyush Tantia just a couple of weeks ago in course of our many projects, and invited him to participate in today's panel. He's the Chief Innovation Officer from Ideas 42. So he'll explain a little bit about his organization and what they've been up to. Craig Ackerman, who is Vice President for Operations and Business Transformation at MITRE, has been working with a team to help create what's next, and for our own organization, MITRE, with close to 9,000 employees and many, many physical locations. So Craig's going to give us some insight into the nuts and bolts of what we're trying to do to continue to have our workforce be as productive and healthy as possible. And then Craig Petrun, who's a psychologist and an expert in strategic engagement and organizational design, I asked him to put on his psychologist hat so he could help us diagnose the angst that we're all in as individuals and as organizations, and help us understand a little bit about the science that relates to behavior change. And he'll be accompanied by Angie Hinsey, who is also an expert in organizational systems here on our MITRE team. So let's go ahead with our few presentations, and then I think we're going to have a good amount of time for questions and conversation among the panels. So Piyush, you're up.
Thank you very much. So let me start with a very quick intro to what Ideas 42 is. We're small, about a 100-person nonprofit. We focus on innovation using the behavioral sciences. So that's largely social psychology, behavioral economics, some cognitive science, and specifically judgment and decision making within that. And we design solutions to change behavior, and then implement and test those as far as possible, and most often with randomized control trials in the field. So we're kind of like an R&D lab, working out in the world, implementing things. So what I thought I'd talk about today, I picked three areas. There's so much to talk about with this topic of going back. So the first thing I thought I'd talk about is habits. There's a lot of interesting psychology research done by Wendy Wood, Baz Verplanken, and various other colleagues on this. And they find that habits, which are pretty much unconscious behaviors that happen quickly, automatically, right? They get triggered by physical environment, like little things. Like if you have a bowl of candy on your desk, you might have formed a habit of popping one every few hours. But now if you put that bowl away in a drawer somewhere, not only is it hidden from temptation, but it also can break the craving that may have, the habitual craving that you may have formed, right? So those sorts of small changes, and those are the experiments to do. So as we come back to the office, right, there is a risk that even though we are being vigilant right now, eventually over months, we will revert to old habits because everything looks and feels the same. We've become used to a home work environment. We go back to a familiar office environment. We revert back to habits that we don't want. So, changes to the physical environment beyond signs, et cetera, would be very helpful. Fewer chairs, or they're in a different place, etc. Those sorts of things. This is a big opportunity because people are vigilant right now. So this is a moment when it's easier to achieve behavior change and to break habits. So we can really build those new habits. And then they have an added benefit where if you get some people adopting something like wearing a mask or distancing, then other people adopt it also, and we start to build these new social norms for the workplace. But it's normally very, very difficult to build social norms. So that was one kind of very interesting area that's worth digging into as we all come back that I wanted to talk about. The second is beyond the physical environment. What about practices, just norms for how we work? Are there opportunities to actually change those for the better generally, right? So meetings, right? A lot of us find meetings to be taxing. John was just talking about 16 that he was scheduled for today. They often fill up our calendars. I hear people saying like, oh, when do I get to do real work? I'm going from meeting to meeting. But meetings in small conference rooms with no windows or poor ventilation can also be places where the virus can spread, right? So what if we take this opportunity to change defaults on whether we need meetings for everything? Can those meetings be shorter? Can we start with a default of 30 minutes instead of an hour? Can we do walking meetings if it's just a couple people and the weather is nice? So this is again an opportunity for doing things that are just generally better. And then thinking outside of the office also matters. Now, I live in New York, very crowded subway. It's a public health disaster. As people start coming back, I kind of don't want to go to the office in rush hour and cram into a subway. It's very, very crowded. So could we do things like changing the workday around or staggering people's schedules as far as possible so we reduce some of the overcrowding? And that's just one example. There will be other effects of coming into the office also. Okay, and then the last thing I wanted to talk about is something pretty speculative and a bit of a crazy idea, but I figured this is a group of very smart, creative people who can make things happen. So it's worth throwing out there. So something that comes up a lot in our work that's really important to make behavior change stick is feedback. If you get feedback on how you're doing, you tend to chase goals and tend to follow that feedback. So a great example is the Prius. And if any of you have driven a Toyota Prius and they came out, they give you these little bar graphs that show how you're driving and how much fuel you're using. And that changes behavior. Right? In fact, if I remember correctly, someone even studied this, and there was actual change in how people were driving. So could we give people feedback on how they're doing and how careful they're being? Like, this is something I personally have craved since the beginning of the crisis. I changed a lot of my behaviors that I normally do, but how did I do? Right? Other than knowing that, okay, I did not catch the disease, I don't have feedback. Am I doing too much? Am I doing too little? So if there was a way to build technology and using sensors, an app that just tracks how much time you're spending with other people, are you spending too much time in proximity to others, too little? How are you doing relative to your colleagues? Something like that could be really interesting. So let me end there with that sort of crazy idea. Obviously, it would have to be an opt-in, etc. And turn it back over to you, I guess, FX or Craig.
Yeah, that's great. Thank you, Piyush. That definitely is some food for thought. And I already have a few questions for you. That's good. And actually, Craig Ackerman's been thinking a lot about this, about these metrics and about methods. So I'm going to let Craig, I think you have a couple of slides to show, Craig. So
yes,
Susan,
I do.
Why don't you show us those slides, and Craig, I'll let you take it away.
Terrific. Thank you, FX. And thank you, Piyush, for that lead-in. Hello, everybody. As was mentioned at the outset, I've got responsibility for operations and business transformation at MITRE, and wanted to talk a little bit today, a small amount about some of the actual steps we're taking, but with a focus on why are we taking these steps. So first of all, we're calling this return to the workplace, return to office. We're intentionally not saying return to work because we've all been working. We've been working remotely. We've been working quite effectively. And based on some of our surveys, many of us want to continue to work remotely for many different reasons. One, we're all trying to balance family demands, especially as we look ahead to the fall. And just this morning in Northern Virginia, where I'm based, the school systems are putting out options in various counties. Do you want the children to return full-time, part-time or do 100% online learning. So there's a childcare aspect to what's going on in the home. Oftentimes there's an elder care aspect where we've got vulnerable populations at home. So within MITRE, we've been quite fortunate that Jason Provodakis, our CEO, has said from the outset, top 2 priorities. Number 1 priority is the safety and well-being of our employees and their families and the communities within which we work. He starts every conversation by emphasizing that comes first, followed by, of course, then delivering our work as we are expected to do. So let me talk you through some of the return to office resources that we've put in place to help us safely return to the office, yet with a consideration for the safety and wellness of all of our employees. And I kind of break it down into 3 quick parts. 1, what we know and believe. The second, how we feel about what's going on. And the third, what's expected of me. So in terms of what we know or how we're supported, MITRE has tried to set up a relatively simple internal resource, these COVID-19 resources. This is just one snapshot. And you can see on the upper right-hand side, there's 3 pieces. There's the COVID-19 home base listing of resources, frequently asked questions. These come not only from the questions that we as managers hear, but also we have, our CEO leads a weekly COVID call. He does it rather effectively. He leads it in Microsoft Teams, and we get to hear from Jason and other experts throughout the company in the main screen, and then running down the side, everybody submits their questions. And some of the questions he'll answer directly on the call, and we always post those calls afterwards so employees can go back and listen to them if they happen to miss it. But then we capture those questions, and we're continuously adding to these FAQs with consistent responses, not the response I got from my manager, but the MITRE response to every one of these questions. And then very importantly, the 3rd tab on here is about well-being, a collection of well-being resources. It's about how we feel about what's going on. Each of us has unique needs. Each of us has unique feelings about all of this, the different fatigues, Zoom fatigue, COVID fatigue, you name it, or actual physical needs. So we've got a good collection of well-being resources. And you see the last thing I'll point out in this slide is we've outlined a phase 0 through phase 3 of our expectations for return to office. Back to what's expected of me in phase 1, which is the phase that we're currently in, we've kind of captured at a high level what the return criteria. There's more elaborate details behind this, but this gives everybody at a high level kind of what's expected as each phase as we go. Now, we will note that these phases are also defined geographically. MITRE is characterized by, or largely our employees are spread across 2 campuses, one in Bedford, Massachusetts, outside of Boston, one in Northern Virginia in McLean, but we also have 58 other sites around the country. So we're tracking what's going on at each of our sites. And for example, just yesterday, our location in Texas returned to phase 0 because of everything that's going on in South Texas. Let's go to the next slide, please. Okay, this is just a quick look, and certainly I suspect these slides will be available afterwards, but it's just a quick look of some of those resources that we make available to all of our different employees, whether it be guidance on returning to office and different floor plans, to some of those well-being resources, to highlights from, we love to highlight the work of the coalition and some of the information that's out there, whether it be the Healthcare Coalition on the Partnerships tab in the bottom, to the Fight is in Us, the National Plasma Registry. So let MITRE employees feel good about some of the work of that their colleagues are doing to help the nation as we all work through this together. Okay, last tab. And then we talked about what we know and believe. So in those calls that the CEO leads, he frequently gives some time to Dr. Jay Snitzer. Hopefully many of you know Jay. He's our Chief Medical Officer and Chief Technology Officer. And Jay does a great job of summarizing kind of the week's news from around the world, where we're at with the coalition and what it means. So this week he spoke about return to school. He spoke about college-age kids, which I have, 19-year-old twins, returning to college campuses, all the way down to the little ones, and what it means for them to go back. So oftentimes, Jay gives us an expert opinion. Jason gives us the leader's perspective, so we all stay grounded and we know what's expected clearly. And then together, they commissioned an internal dashboard. Externally, the coalition has a decision support dashboard. Internally, this is what MITRE put together. You can see the tabs across the top. I've just pulled up one in particular. But as we're looking at return to office, we're taking, as I mentioned, a geographic approach where you can click on the drop down for any one of the states, and you can see for a variety of different aspects, how are we trending? What's the 14-day new hospitalization trend? What are the new cases per 100,000 residents, et cetera? And this dashboard that's shown below is clickable by, you can see the MITRE locations in the state of Virginia that are noted, and you can actually drill down to the county level and see what's going on county by county and how they're doing against these 5 separate metrics. So we're asking each of our site leaders and those who work at those sites, giving them visibility through this dashboard that's available on our intranet site. They can get up to the minute, consistent information as to what's going on in their county to help inform whether they return to the office. Importantly, in this first phase, we set a goal of no more than a 30% density in our office space. So we said, there's certain people that have always had to work in a MITRE location. They do secure work, they work in our SCIFs locations, and we've taken many precautions to make sure those are safe environments and everybody knows how to socially distance within the workplace. We've issued masks to everybody, et cetera. But for those who have the option to continue to work from home, we're asking that they do so in an organized fashion. We don't exceed 30% density. We're tracking that in various different ways and informed by local considerations and, importantly, their personal situation. Lastly, Jason has said many, 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 many times, return to office will be an employee by employee choice guided by data. So I'll close there and turn it over to the other Craig.
Great, thank you, Craig Ackerman. Now, Craig Petrun, we'll let you go ahead with your
program. Good afternoon, everyone. Can everybody hear me, first of all? And good, I'll try to build on a little bit about what the other speakers said, but when we were getting ready for the call, we were talking a little bit and we were talking about how much information is actually out there right now about COVID-19 and returning to work and how it's been disruptive to companies. It's almost overwhelming. So I did put a reference slide together that will be available that has links to a lot of things I'm talking about because we have a little bit of time I can't go into much detail on these things, but hopefully we can have time for questions. The first thing has to do with the role of the individual change process. So when I think about going back to basics as a psychologist, and we're talking about people coming back into the work environment, or it could be even changes in the community, changes at home. When someone is trying to change something about the way they behave, which we all are doing now, right? Because the new normal, or the changing normal, I guess, is forcing us to develop new behaviors. And this is a model by Prochaska and DiClemente. Those in the healthcare industry will be very familiar with this. But it's an individual change model. And what's nice about this model is it says that everyone goes through this process. So if we want to change something about our behavior and intentionally change it, that is, this is the process that we're going to go through. There's been at least over 129 studies done on this model. I'm sure there's been many more. But one of the common things that they've found with this model is that when the change is intentional, when it's something that the person wants to change, it's much more successful at changing that behavior to get to the habit. So Piyush talked about, getting to a new habit or creating a new habit. Well, that's much more successful when the person wants to do it. It's intentional. when it's forced on us, when it's based on fear, those behaviors tend to disappear over time, or especially when that situation goes away. So as people come back into the work environment, we want to give them lots of information, kind of like as Craig Ackerman was talking about. We have a lot of information available to us at MITRE to help us make decisions, to give us a sense of control, to make that decision and what we need to change when we come back into the work environment. One of the other reason I chose to talk about this model a little bit is, as a manager and a supervisor and a leader, or just even as a parent at home, when someone has to make a behavior change and they're struggling with it, don't think that they're just resisting for the sake of resisting, right? What you need to do is find out, where are they in this change process? So for example, when we say it's time to come back into the office or come back into work, some people may be saying, well, gee, as he said, I'm working really well at home. I have no need to come back into the office. And if it's voluntary, then that's fine. However, if an organization is going to make it mandatory for certain folks, you need to kind of start to explain the why. You need to have to get them out of that pre-contemplation stage. You have to get them understanding why there's a need for change, so that they can get to the next stage, which is thinking about, what do I have to do to be successful when I get back into the work environment? What do I have to do to be safe? What's it going to be like when I get there? So you get them to that contemplative state where they're starting to think about change. Once they understand it and think about what they need to do differently, we see people go into what we call this preparation stage, which is they start making plans. They start to think about specific actions they want to take to get there. So for example, the person, I think he's gone now, but he talked about establishing healthy behaviors. We have to exercise. We have to take work breaks. That's a new behavior. So you can't just go back work or continue working at home and jump into what we call the action stage, where you start just automatically every 2 hours doing healthy behaviors. You have to think about it, contemplate it. You have to prepare a plan for it before you start taking action. If you jump into the action phase too quickly, you're going to fall down that spiral of change, and you're less likely to get to that point in the curve where you can establish a new habit. So as a manager, leader, supervisor, if you see somebody struggling when they come back into the work environment, or even if they're staying home, you see somebody struggling in your family, try to find out where they are in this change process with what they're trying to change, the behavior they're trying to establish, and give them what they need to get there. Is it information? Is it links and things to the actions they can take that have been successful in the past? You can figure out what you need to help them move through that change curve. Now, next slide. The second concept I want to share and talk about is the work of David Rock. I'm guessing most folks have heard about this by now, the SCARF model. He's very good at publicizing it. It's been written up in many places. He's in Forbes, he's in Fortune. He gets a lot of press for this model. But it has real implications for us as leaders and managers when people come back into the workplace. When we start to understand what's going to be different, they may not be able to get into conference rooms with large groups. They have to stay small. They have to continue to isolate a bit. That's going to affect kind of what we call the SCARF factors, the status. You know, how does it affect how we're seen and viewed by others, by our leadership team, how we're, rated in terms of performance? Certainty of what we do. Do we have as much control over how we worked, where we worked as we did? Autonomy. Do we have more choices or less choices? I mean, today, most of us, if we're knowledge workers, we have a lot of choices about how we work. It's people don't usually always want to know what we're doing. It's like, when are we going to get the work done? So we have a lot of autonomy. Is that going to continue? Relatedness. Do we still have relationships with important people in our work environment? Do the leaders still listen to us? And then fairness, okay? Are the decisions being made about who comes back to work, not go back to work, what we have to do when we come back? Are they fair? And one of the things about fairness is transparency. And I know most organizations today understand this concept and are pretty good about making the decision process transparent, because that's really important to fairness. Now, what's important about this is the amygdala, right? So on the left side of the screen, hope you can see it, it's big enough, but the brain experiences changes to the social environment that we work in, just like it does physical pain. So, right, so probably back around 2005, when we were doing all these MRIs, we found out that the brain lights up in the same way when we change one of the scar factors as it does when it experiences physical pain. So when we get that amygdala hijacked, when the amygdala lights up, as we go back into the work environment, things are changing all around us, right? Just realize if people seem resistant, if they seem remote, if they seem distant, some of that isn't just because, you know, they're not happy or they don't want to be there. It's because they're experiencing this physiological change in the brain, which occurs when some of these factors change. There's a link in the references I gave you. David Rock talks about a company that he worked with and what they did to address each of these factors. I don't have time to go into it right now, but you know, he clearly laid out everything a company can do to address every one of these factors. So it's an interesting read and an interesting thing to think about. The last thing I want to leave you with, when I was doing just reading for this webinar, I came across some work by David Kessler. David Kessler was one of the folks who worked with Kubler-Ross around the 5 stages of grief. And he pointed out some interesting things. It's in the July 2020 issue of Harvard Business Review. But he talked about when people come back into the work, we have to be worried, not worried, we have to understand they're coming back in 3 different places in terms of their emotional health, right? In terms of their grieving process. There's those who are worried well, he calls them. People who are worried well have not been touched by COVID at all. So they see it on TV, but they don't know anyone who's personally been affected by this. So they're kind of worried about what they might lose in terms of social things, but they're not, we call those worried well folks. Then there's the affected people. The affected group of folks, as they deal with this grieving process, they've actually seen or know someone who had COVID, right? So they've had some firsthand experience, but not direct. And then there's the bereaved. The bereaved group are individuals who know someone very personal to them who died from COVID. So all these groups are going to be coming back into the workplace. So when you're kind of wondering why some people are lagging or some people are moving ahead in terms of adopting some of the workplace changes that you're throwing at them, you have to realize that, and this is where we have to listen. As a leader, as a manager, a supervisor, we need to talk to our staff and understand what did they experience while they were outside the workplace and where they fall maybe in one of these 3 groups, because it's going to affect how they respond to something that we're asking them to do. So I'll leave it at that. But those are some of the things that I think from a psychological standpoint, we need to think about when we try to help our staff when they re-engage in the workplace. Thank you.
Thank you. I'll ask all the panelists to turn on their video and their mics. Thank you. That's really a great portrayal of what we're going through, and I think each of the speakers I could relate to a few things from that each of you mentioned. I just wanted to ask Angie Hinsey if she had any additional comments about what she heard and maybe react to what she heard.
Sure, thanks, FX. So just to bring it all together, I think one of the things that you're hearing from all the panelists is how important it is for people in various organizational spaces, especially managers, to take a people-centered approach to how you engage with people when they come back to the workplace, because you just can't assume about what they have experienced, how they're currently experiencing their home environment, even their experiences at the grocery store, other businesses that they're going to, as well as what they're experiencing in the workplace, especially if they're adopting different workplace practices, like, for example, adopting a hybrid model where they're working at home part of the time and coming into the office part of the time. So that's probably the overarching message to reinforce, is taking a people-centered approach. The other thing that I would suggest that we reemphasize is listening, and that we have all of these wonderful ideas and models for how you put information out in lots of different ways so that it's perceivable by different groups of people, that they're able to receive it in different ways. But it's also important to set up spaces for people so that you can just listen and you can get feedback and gather feedback. I want to point out that when Craig Ackerman was talking about some of the things that MITRE's done, it's always interesting to me how there are feedback loops, that there are feedback mechanisms even during, the senior leader calls in the web page. So when people access those tools, they have a way of engaging. It's not just pushing information, but it can be multi-directional. And so the same is true if you're able to invest in one-on-one or small group conversations with your people when they're coming back, and being able to do that frequently, that you should be spending more of your time as a manager in particular listening and seeking to understand what people are trying to tell you in terms of what their lived experiences are like. Because you can't make assumptions that they're experiencing even the workplace the same way that you are. And so gather their feedback, ask for their feedback, make space for them to even disagree with some of the tactics that have been utilized, so that those things can be modified and adapted, because we're all learning in real time to something that's really unprecedented. And that the last thing I'll say, and this kind of gets to everybody's points in terms of feedback loops, is that serves as a very important positive behavioral feedback or reinforcement mechanism, which goes to the points about ensuring that people understand that their behaviors are being perceived, that they're being valued, and that they matter, and that they're appreciated, because people want to know that what the changes that they're engaging in, if they are able to engage in these changes that they're being asked to make, are that they matter, and that they are making a difference in terms of people's comfort in the workplace. And so make sure you highlight those. One last thing I'll say, and then I'll pause so that we can do Q&A, is that it's important for people to understand who the best deliverers or what the best delivery mechanisms of messages are. Sometimes those opinion leaders that people need to hear from, or those trusted people that people need to hear from, aren't necessarily those that you might expect. Sometimes it is senior leaders, and sometimes it's that person who speaks up, usually in meetings, and when they speak up, everybody listens. And so it's important to really identify within your organizational structures, who do people listen to, who do people respond to, who do people feel comfortable with, and are you setting up spaces for them to be able to share in a way that's meaningful for them, where they can be vulnerable, where they can show whatever emotions they're experiencing as it relates to the. Thanks, FX.
Fascinating to hear so many strands of management speak, as well as what I think about as chronic disease management. Craig, you talked about the readiness for change in the pre-contemplation phases, and this is what we learn about as a primary care physician, but when we're trying to help a patient quit smoking, for example, or to adopt behaviors to help improve their diabetes or their heart failure. And it, time and again, we'll identify a person who's really having a challenge with that, and others seem to do well with kind of a fairly basic intervention. And the model that you described is so true, and there really is no way of shortcutting it. But this leads to the need for organizations to have tremendous patience. And I'm just thinking now, because we're having such financial problems related to change in business, many organizations have had to cut back on their staffs or to furlough people. And so even having those opinion leaders and those people that listen, they may not even be there anymore. There's been such tremendous change. So I'm just wondering if the panel could talk a little bit about how you manage certainty and uncertainty, because I think there's been such a displacement of norms that people aren't quite sure, what is certain and what's not, and that anxiety is right under the surface.
Yeah, I think you have to allow them to make their own decisions. Again, going back to the individual change process, you can't force them down the decision path. So giving them the information they need, bringing in experts. So, one of the things I think, MITRE's done well is it's not just our CEO, but he always has some experts with them to provide additional information. They always allow people to type in questions. And what's interesting as we've talked through this panel is sometimes I would get annoyed at all the questions that were coming in. It's like, oh, that's a really stupid question. What are they asking that for? They have no social sense, right? But then when you think about what we've been talking about, they're trying to make meaning of the world. There's some uncertainty that's important to them. And we have to be careful not to judge the question that comes in, because I did that myself. I'm watching these questions scroll in on the side of the screen. I'm like, oh my God, that's an embarrassing question. But for that person, it may have some real importance to establishing some certainty back in their world. And so we have to, again, give people some grace as we get back into work and understand that they are coming from all these different points along the change curve.
A fun related note is when we see those comments, we have the ability to click a thumbs up. And the audience has demanded us to answer the questions with the most thumbs up. So sometimes there's this clicking war that's going on. I really want to know the answer to that one. And you'll see, you almost count how much they're clicking up, 20, 30, 40. But one question, speaking of certainty, that keeps coming up is, at what date do I need to return to the office? And our CEO has skillfully avoided that question because there is no answer yet. And he's emphasized remote work is here to stay. So to the extent he can give certainty, he does. But then he also acknowledges, guys, we don't know where this is going. What last week was a peak is hopefully now a decline, but oh my gosh, look where we're going today. So he puts things in certain terms where he can, and oftentimes that certainty is, or the certain expression is, there is no certainty, but the safety and wellness of our employees and their families will always come first and guide our decisions.
Yeah, that's kind of the approach we've taken also, is being transparent about when there is uncertainty, but then giving people at least some short-term certainty. So we said, okay, we're just going to make a call and we're going to say, okay, no back to office at least until Labor Day, and then we will, tell you more at that point. I don't know if there's a perfect answer to dealing with the uncertainty problem, but we're going with transparency. Sounds like MITRE is also, and so far we haven't heard any, deep complaints or major issues come up.
Well, it's interesting to hear you talk about the term transparency and fairness. And it's possible that really the certainty that people want is transparency and fairness, that they want to know the facts to the extent that it's knowable. And then they would like to be dealt with in a fair manner. So I think if people were certain that their managers, their organizations are dealing consistently with transparency and fairness, then that's going to give people a sense of willingness to take the leap and share that uncertainty and the angst that goes with it. I was listening to a podcast from Dr. Fauci the other day, and he observes that there seems to be forces at play that would in some way put the public health practices and the opening the economy as two opposing concepts or two opposing forces. But he wants to foster the concept that we all want to return to normal, or we all want to make our way forward. We all would like the economy to be open and as productive as possible, but that's the public health tools that are going to help us get there. So that actually the public health methods are part of the tool set that we have, and that it certainly isn't an either or phenomena. But many individuals aren't familiar with the purposes of the public health measures. It may seem apparent and obvious to many, but others it seems like a stretch. So I think that constant perspective of fairness and explaining why is key. But I'd like to hear a little bit more about your thoughts on that, this theme of transparency, and how do you actually how in a large organization, how do you get enough voices involved? Because there are great ideas in many of the frontline workers that could be transformative for organization. How do you harvest good insight and good ideas within a small or large organization?
Yeah, I can jump in with that a bit. So there's all this work on procedural justice. I think psychologists, we always come up with these terms that are not often easy for others to follow, but make sense to us. And this is all the psychology of whether people feel like they had a say in the decision making or not. And that affects whether they feel that the outcomes are fair or not, regardless of what the outcomes are. If they didn't get to participate, they will tend to feel that the outcomes were unfair. So I think it's about, in a large organization where you have thousands of employees, I would guess, and I don't know of specific studies on this, that as long as people feel that they had adequate opportunities, right, to speak up. So there were several channels, there were town halls, there were places they could put suggestions, as long as they feel like, yeah, a lot of attempt was made to get input, and then there are salient examples where that input was listened to. So, if you do take a suggestion from somebody, to give credit so that everyone sees like, oh, great, yeah, we're actually listening to, everyone. And this is not just all coming from the top. I think that will make people feel better, and we try to do. We're much smaller. We're just 100 people. It's much easier for us to do that than MITRE or other organizations, of course.
Well, I'll add, we took a shot with our 9,000. 4 weeks after we went largely remote, we sent out a survey. And the survey was constructed in partnership with Kessler. So Kessler is a national design firm, and they're looking at the return to workplace challenges across many organizations. So they helped us miterize a version of a survey that they're also casting a wide net across multiple organizations. So we got two views. We got the benchmark view, and then we got the MITRE employee view. Importantly, we built in some comment clauses, so people got to say how much they wanted to continue to work remotely, et cetera. And we've since shared those results spoken about them on a weekly call, as well as shared them on our intranet. But we were careful to read every single one of those comments. We had 200 pages worth of comments. So we actually hired one of our own teams to sift through the analytics and say, what's this telling us? And I was just quite pleased. I was on a call this morning where we were talking about tracking software that's going to allow us to reserve offices. 3,000 MITRE employees share an office with another employee. And we want to create a way that you can reserve that office or half that office and not worry about the other person also being there that same day. Yet within a block of offices, okay, my office space wasn't available, but I can get one 2 doors down where neither occupant is in that day, or I can go to a nearby hoteling space. So we specifically referred to the results from the remote survey as we built this program to reserve space so people feel safe as they come back into the work environment.
FX, if I could add to that, what I loved about that survey is that it didn't make any presuppositions that everybody was experiencing the change negatively. It provided room for people to also talk about what they liked about what they were experiencing, what was good. And so also, gathering and being intentional about people, pointing out what's still happening and what's also better now because of what we're experiencing also helps people to have a sense of control and a sense of fairness, and opens up the conversation to be wider, to receive a wider variety of feedback as well.
Yeah, one of the things that I didn't have a chance to talk about, and I'm sure Angie, you would weigh on this, but psychological safety and having psychological safety in the workplace is so important to getting people to speak up and be honest. And psychological safety is really that people kind of having the confidence and knowing that if they do speak up and say something, they don't have to worry about retribution, they don't have to worry about impact on performance and things like that. So, making sure leaders are aware that they have to be, careful how they respond and relate to their staff, because if people don't feel safe, they're not going to speak up, they're going to hold it in. And it's interesting in this company that David Rock worked with, they did weekly pulse surveys, and they were not anonymous. Everyone could be identified. and people rated their stress level. And people who rated their stress levels high actually received a call from a stressor expert in HR. So they felt confident enough to share how stressed they were, knowing that somebody might call them. Now, to me, that's a really good sign that people in that company feel psychological safety. They were willing to actually honestly share how stressed they were about working at home.
That's good. I'm just looking at our chat. There's a couple of really interesting questions. One is a participant who's saying that the external financial crisis is really challenging for many organizations, and in some states, the governors have put into place a moratorium on changes in rent, or moratoriums on evictions from rents. Talk a little bit about that societal level, that public policy level. You know, we've been focused mostly on the employer right now, but obviously there's maybe things employers can do to help people with their rent, but that could be a very vulnerable conversation. Does one of your employees have enough to pay their own rent? And what can we do from a social policy perspective, but then what can also an employer potentially do?
I'll take a first stab. That wellness tab that we mentioned has links to various resources. So we have EAP resources available. And so instead of trying to answer it for everyone, we want to make sure that everyone knows resources are available for you. So we emphasize things like Teledoc, our telemedicine system. We emphasize EAP and other resources to which employees can turn based on their individual needs.
Yeah, the social policy level, I noticed that question too, and this is something I've been thinking about because we ourselves at Ideas 42 are trying to renegotiate our office leases. And there's research going back to times when real estate markets have crashed. And it shows that people tend to, owners or sellers in those markets tend to take very long to adjust down on what they believe their property is worth. And that's because we hate to realize losses. Like this was the theory that got the Nobel Prize and got all this behavioral economics craze started in the first place. And this might be happening to landlords, whether they have rental, residential rental or commercial rental, where they haven't really adjusted to what a reasonable market rent is in this new world. And there are no benchmarks, right? We don't have a lot of flow or transactions happening. So if a government could do something to set a different benchmark or anchor out there, like, hey, your rent is not up here, it's actually now here. This is the best analysis that we can do. Right, that might help some of these landlords adjust, do rent reductions, give people a break. We've had conversations with banks, at least one large bank that's already doing this with their loans. They're proactively going and reducing people's payments, which we thought was fantastic.
So it's worth asking. And part of this may be empowering that employee to be aware of what their resources are and giving them a voice to say it's okay to talk about these things. And we've got a way to make it a constructive engagement, but these can be incredibly stressful factors. I recently had a patient who was in the same situation, and they didn't realize that they could ask their landlord to, because it's not a person, it was a big corporation that owns their building, and they didn't really even know how to interact there. But the fact is, every organization is learning quickly, whether they want to or not, and sometimes it is bad news that the rent's not coming in one way or the other, and you're maybe better off having people in there paying half the rent than no person's in that and having dissatisfied renters. So,
Yeah.
One thing I'd like to add is, again, our CEO in his weekly calls has stressed multiple times, now more than ever, it's vital that we check in 100% with all of our employees. How are you doing? What has you stressed? I think of Maslow's hierarchy of motivations, and if that base level of security isn't there, we can't bring our best selves to work. So whether it's financial concerns, health concerns, whatever they may be, it's incumbent on us as leaders and managers to check in and know where our people are and know that they feel okay, and help them find those resources they need so they can return to their best selves.
If I could just add to that, Craig and FX, also it depends on the size of your organization and your organizational culture. It's one thing to make space and create space for people, check in with them and that sort of thing. But if you have the kind of organizational culture where people are willing to pool resources, whether it's skills for talking to landlords, or even resources like we started doing PTO sharing at MITRE, you know, really thinking about how are you set up? How is your organizational structure set up so that people can help each other? And how can you do that in a way that still respects people's wishes for privacy, but gets to some of those things related to food insecurity or housing insecurity? And I want to specifically make a plug right now, especially if you work with a younger workforce. They're going through so much transience right now. And so just being mindful of creating as many solutions as possible in terms of flexibility for work and setups and being able to work remotely for longer and helping people to be able to balance all the competing demands that they have in their lives as they're trying to figure out how to regain or reinstitute stability in their lives as well.
I have one thing. I'm looking at the questions out there, and there's a really interesting question about mask use. And, you know, has someone thought about putting out a unified statement, you know, like businesses coming out and, you know, having a unified statement about wearing masks? And there's an interesting reference in my little PowerPoint on references. It's called The Psychology of Wearing a Mask. And we don't have time to go into it, but let's say it's very complicated. So if you think about the individual change process and the pros and cons, and, you know, the pros outweigh the cons, what you find is that there are many different reasons people decide to wear or not to wear a mask. And you have to understand that individual reason that led them down that path in order to potentially ask questions to try to get them to think differently. First of all, you can't force them to think differently. So what I learned from that article is that you can have every company and every politician say wear a mask. There will be people who won't wear a mask because in their decision process, the pros of wearing a mask do not outweigh the cons. And so unless we mandate it, make it, you know, legally against the law, like we do with seat belts and not smoking in planes and things like that, people are going to not do it no matter what you say. So if it has to be done and we don't make it a law, I think you're still going to find many, many people not wearing a mask. And that article is really insightful about the thought processes people go through as they make that decision. And when I read that article, it wasn't really, I didn't realize how complicated it was, and just in terms of what people go through to make that decision. It's very complex.
Yeah, I'd like to add a few technical elements. The first one is, in MITRE, we said, A, we issued everybody a mask. B, we said, if you're going to go to the cafeteria or traverse the hallways, it's required that you wear it. But I see this, and I see this as people walk through the hallway. Now, our CEO said, we will not be mask police. So, but he did emphasize multiple times grace and respect, which is one of our key principles. You know, let's have respect for others. It may not be for you that you're wearing the mask. You're wearing the mask for others to feel safe passing you in the hallway. And then the last thing he said was, if you have a medical reason why you can't wear a mask, do not come back into the office. It is required that if you come into the office, that you abide by wearing a mask when you go to the cafeteria, the official guidelines are is when you cannot maintain social distance. So by giving those simple parameters, it handles most of the concerns.
You know, I think that's a great note for us to end on. I think the mask controversy and the mask issue is not a simple one, and it's raging in every jurisdiction, and it's absolutely a hot topic. So I'm hoping that everyone on the call can make their own personal decision about their mask, but in my opinion, you should put the thing on or don't go out of the house.
Yeah.
Read that article.
It's very insightful.
It really is one of the best things that can be done to help mitigate the risk to others. So I wanted to thank the whole panel. I also put into the chat a notice from another project we have within the coalition, the Telehealth Impact Study. We've mentioned it in the past, and we're progressing in the next phase of the impact study. We are starting a survey of providers, physicians, and other caregivers. And so the link is in there. We're hoping that the provider organizations within the coalition, many of you are on the call today, could bring that link and communicate it out to your own medical staffs. And we're hoping to get a good response over the next few weeks. So read more about that. And thank you to our panel. Next week, we will be focused on senior living. So not only skilled nursing facilities, but other forms of senior living. And the topic, again, is very rich. And I think you've set the table for some of that conversation already. So thank you to each of our panelists, and keep up the great work you're doing. And thank you for your willingness to share today.
Thank you for having us. It was good.
Yeah.
Yes,
Thank you.
thank you.
For the
Yes,
invitation.
thank you.
Bye, everyone. Stay safe.
Thanks.
Well,